Greetings, friends and followers. This is Nurses Talking. I am Dale Barcy. As always, if you like what you see and hear, subscribe. Leave us a comment and let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. Today, I am very, very pleased to welcome Carole Jakucs. Carole has been a registered nurse for over 26 years. She's worked in different areas of nursing, including telemetry, med-surg, pediatric ER, trauma, a clinical nurse supervisor as in college health, and currently she works as a diabetes nurse educator and healthcare journalist. And she says that her goal is to expand her reach and ability to teach others about health and wellness strategies and self-care. So welcome, Carole.
Thank you. Thank you for having me, Dale. Thank you.
My absolute pleasure. My pleasure. My pleasure. Well, first of all, how did you come into nursing? What brought you here?
Well, no one in my family was a nurse, and at the time, and when I was a little girl, I think what triggered my thoughts on becoming a nurse. When I was a little girl, I had my tonsils removed. I was probably about 5 years old, and I remember clearly one nurse. She was amazing. She was just amazing, and that was really, I have to say, my first exposure to a real nurse, at the time.
Yeah.
And I think, she was so caring and so comforting. You're a little child in the hospital. Everything's so, you're fearful of everything, right? It's all so new. And of course, you're not feeling good either. You're uncomfortable if you just had your tonsils removed, obviously. So anyways, I think that was the first little spark for me that pushed me into thinking about a career in nursing. I also, a short time thereafter, we had a family physician who was also a family friend, and he was married to a retired, well, she was retired because they had a large family. He was married to a former nurse, and she was one of the kindest, most amazing persons I ever met, and smart, very smart. And I think through the years as I was growing up, having some exposure to her also planted the seed for me for having a career in nursing.
So, okay, so you had touched the field, the healthcare system at a very early age. And
yes,
then,
unfortunately.
Well, I know how that is. I had my tonsils out at 10, a little older than you, but I get that. But then, you knew someone and it's socially who was a nurse and who impressed you as being kind and intelligent, and those are things you now associated with nurses. When you got to be a nurse, what was it like for you? Was it what you thought it was going to be?
I think so, yes. I think so. I had thought about it for a long time, and I was lucky that I was able to follow a nurse at a hospital. I actually had a trip to Florida to meet a friend and have some time together. And my kids, her kids, she and I, and her sister was a nurse at a hospital in Florida. I believe she was a charge nurse at the time. This was several years ago. And she says, "Oh, you're thinking about nursing?" So I went into nursing after I was married and had my children. And I said, "Yes, I am." She says, "Hey, do you want to follow me while you're here? Follow me for a shift." And I did. So even though I live in Southern California, I grew up in Ohio, but I live in Southern California. I actually, my first follow along, so to speak, or ride along, so to speak, with a nurse was in Florida. And it was a really good experience just to get a real taste of it, what it was like. So what was it what I expected? A lot of it was, and then some of it was not. Some of it was not. Clearly, I think any profession, once you really step into it, there are unexpected challenges or just things that you just don't expect, and because you just don't.
Yeah. And I typically ask that, especially with nursing, just because well, I know that what I saw and what it was did not immediately align.
Uh-huh.
So what I thought and what it was did not immediately align. But even then, I became a nurse way back in the mid-70s. So, and not only did I become a nurse in the mid-70s, I became a nurse. I went away from home to become
Ah,
a nurse. I grew up in the Caribbean. I went to England to nursing school. And so it was a lot different than I thought it was going to be. And so I wonder very often if what we see and what we experience, how soon do those two come together? I thought it was a nunnery.
yeah. Well, I will say my first job as a brand new nurse, once I was licensed, was a new grad program at a local hospital in med-surg telemetry, right? And what was unexpected was just the heavy, heavy load at this particular hospital, and probably many were like that at the
Yeah.
time, and many still are, unfortunately. But there were what I was so surprised at was the high acuity of the patients,
Hmm.
and each RN was assigned patients, eight patients with one
Yeah.
aide. And that was, boy, you had to get on your game and fast to to
Yeah.
get all the care done and properly and safely, right?
Yeah.
So
Yeah.
that was a great experience on one hand. On the other hand, it was like, wow, just diving in, full force. So that
Yeah.
was surprising because, in nursing school, when you're doing clinicals, all right, you have a preceptor and your professor's there, right? And
Mhm.
back to those days, and you might have two patients you're caring for, and then you get your first job, and wow, it's eight, and boy, all eight are on telemetry. And guess what? There's no monitor watching this telemetry. You're trying to dispense medications, prep people for surgery, and try and watch
Mhm.
these monitors. It
And
was
what?
really surprising, but
Yeah.
I did it, and
Yeah.
it was a great experience. It was
Yeah.
a
Yeah. Yeah. You develop what I started to call the octopus syndrome,
that's right.
tentacles everywhere.
Yes, yeah, that's true. That's a really great way of putting it. Multitasking to the 10th power, right?
Yes, indeed. Yes, indeed. Yes, indeed.
That's
And,
great.
and so you worked in several different areas.
Yes.
How come? I mean, I think most nurses do, but is it because you were trying to find your niche or because opportunities just presented themselves in these areas?
I think it was a little bit of both, depending on where I went from where to where. I'm the type of person, generally, I'll stay in one place a long time if things are what I need and I'm happy and everything's great. I'm not one to jump around. Like, for instance, we know that now the last maybe 10 or 15 years, there's a tendency for some people to hop from job to job very quickly, right? And move on from one place to another fast. But my first job, I liked it, but eight patients, med surge tele, and the actual location where it was, they had, shortly after they hired us, they had gotten rid of monitor, uh, you know,
Hmm.
technicians. So, I mean,
Yeah.
that's a lot. And so I thought, and I did not like 12-hour shifts either because I had
Uh-huh.
smaller children at the time. So I wanted to find a hospital role that offered 8-hour shifts. So that was why I made my first move. And then I found it with the pediatric emergency department that I moved to. Right. So, and then
Yeah.
the job after that, I moved on to that because it was at a college. When I left the ER, I
Yeah.
loved it. It was fantastic. But as the children got older, and I thought, oh, it would be nice to be off on holidays and have the summers off. So then I moved into college health nursing.
Hmm.
So
Hmm.
my needs changed over time.
Yep.
It's
Yep.
job change.
I know exactly how that works. I know exactly how that works. But what drew you to diabetes education though?
Well, there it's very interesting because I did not expect to end up working as a diabetes nurse educator. I'm grateful that I'm doing it and I love it. It's amazing. It's amazing work, but I didn't really plan on it. It was one of those opportunities that just presented itself. But as someone who has had people with type 2 diabetes in the family, I've always had an awareness of it in addition to my nursing experience, right? But what drew me or what led me to this field and this specialty was it actually occurred during my master's program. At the end of towards the end of my master's program, Master of Science in Nursing, we had
Mhm.
to do a practicum out in the field, and my specialization was education. So
Yeah.
the place I went to was a local hospital in the ER with their advanced clinical nurse educator, and that was what my practicum
Yeah.
involved, working with her, an advanced clinical nurse educator. So in that time period, uh, definitely anybody that's done field work like this or a practicum, typically you're assigned projects, right, by your
Mhm.
preceptor or whatever, right? So I was assigned, in addition to all the schoolwork from the professor and the
Yeah.
instructor, I was assigned by my preceptor at the hospital to create an educational program for one of the committees she was on. And it was a lot of work, but wow, it was a great learning experience. A lot of work in my spare time, in addition to school and the practicum
Yeah.
hours. And it led me to, once I finished the educational program creation, I had to present it to a committee she was on, and there were various managers from that hospital on this committee as well. And that led me to, um, one of the managers says, "Hey, I have an opening in diabetes education. Are you interested?" And I said, "Oh, I'd love it. I'd love it." One of my classmates in my master's program was a diabetes educator, but prior, in a prior boss that I had been a diabetes educator before she became an NP. So I knew about it, but I didn't really think about it. And I was,
Yeah.
yes, I would love to do this. So that's what happened.
So look how all that hard work just came together.
Yes.
That's awesome. Awesome. As a diabetes educator, though, what do you think is the most important thing you want diabetics to know?
Okay, there are several things, definitely, and some really great tools that they have at their disposal. But unless they see an educator, they probably won't hear about all of them, right? But
Yeah.
the number one thing I would tell anybody with diabetes is make time for self-care, because if you don't do it for yourself, no one else can or will do it. It's impossible. So making time for self-care allows that person with diabetes to do all those other tasks that are involved with taking care of their diabetes, making time to exercise every day or most days of the week, carving out time to cook healthy meals and buy healthy food,
Mhm.
spending time to get good sleep, right? Enjoy life, have some hobbies in addition to work, that work-life balance that everybody talks about. Making sure you have time to test your blood glucose if you're in that place with your diabetes where you need to be testing a little more
Yeah.
frequently. Now,
Hmm.
certainly some people have continuous glucose monitors, right? And that makes it a little bit easier
Yeah.
to check their blood glucose. But if their finger's sticking, that makes it a little more cumbersome and time consuming, right? But at any rate, under the umbrella of time for self-care, making time for self-care, everything else falls under that. And that's what I would say. If I had to choose one thing, make time for self-care. Because if you do that, you can plug in all these other strategies, these self-care strategies that you need to do for yourself to achieve better blood glucose control.
Yeah. 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 And it's such a I always think of it as something as a little bit unfortunate that we have so many people who are diabetics because I think we all know, not just nurses, I think the general public actually knows that it doesn't have to be.
Yes, correct. And I've even used those words in some of my stories. It's so true. Or they don't have to have wildly out of control blood glucose even if they have diabetes, right? And we know that about approximately 95% of people with diabetes are type 2.
Yeah.
Only about 5% or so are type 1, which we all know as nurses is an autoimmune
It's
process.
right.
But type 2, yes, it's certainly genetically influenced, but definitely if your lifestyle is such that you're making yourself at a higher risk level, sedentary lifestyle, overweight, not exercising, not eating healthy, not sleeping, all these things, high stress, it's going to increase your chances of crossing over into type 2 diabetes, first pre-diabetes and diabetes. And you are so right. And I agree. It's now certainly some people try to do everything and they still have developed it. I mean, it's just life, right? No one, at some point something gets all of us, right? We know that. And if someone has a genetic predisposition, of course, they might be doing everything right and still develop. So I try to impart to my patients, don't feel guilty per se and beat yourself up. It's just not a good place to be. But because some people really do all the right things and they still develop diabetes anyway. I mean, I type 2 and I've seen it. I have seen it, not only family members, friends, but throughout the years, patients. But certainly once someone has diabetes, if they can start eating healthier, counting carbs, getting their sleep, exercising, managing their weight or losing weight, if they're overweight or obese, they can bring down their A1C and achieve better blood glucose control. So there's so much they can do. Yeah, there's so much.
There is. And I'm glad you kind of brought that under the umbrella of self-care, actually, because as I'm listening to you speak about it, and what strikes me is that I started to say it doesn't have to be, but then I thought, true that it doesn't have to be, but then there are so many outside forces. You started by talking about a sedentary lifestyle, but our work habits have changed. We just talked about how Zoom blew up and everybody's sitting in front of a computer. Our work habits have changed, which contribute to being more sedentary, the weight going on. We're right at home, a lot of us. Snacks are like right there.
Yes.
And all of that kind of thing, which means that we have to be a little bit more aware and intentional.
I agree. Definitely. Definitely. If, I tell people, even people that I don't see as a nurse, but just people I see socially or in other capacities, right? If you have diabetes or it's in your family, get on the board right away, start exercising. The diabetes prevention program, there was that huge study years ago that proved that there's a good significant percentage of people who can prevent developing, crossing over into type 2 if they have prediabetes. So yes, there's a lot at a person's disposal. Sometimes people know what to do and they don't do it. There are other times people really don't have the knowledge and don't have the information, and that's really sad when they don't have the info. So it's helpful. If their healthcare providers can impart this info to them. But certainly what we do as diabetes educators, there's a lot to it. The sessions are pretty long, the initial sessions, typically at most places that offer it, an hour to 2 hours. It depends on their practice. But so we give a lot more information and education and guidance than a person can get from their physician, because that's why the physician sends them to us. They don't have time to spend an hour or 2 hours with each person, right? They have 10-minute visits, 15-minute visits. So the other thing I'd like to tell anyone that has diabetes or knows a diabetic patient or family member, if they've not seen a diabetes educator, please get an order from their doctor to see one, because it can help give them so much knowledge to take better care of their diabetes. Because
absolutely,
it does not have to be like out of control, crazy blood glucose levels, really high, and making a person at a higher risk for heart attack, stroke, kidney damage, and so forth. They can really just, sometimes there's simple steps they can take. They just don't have the information. So
exactly. And it's a shame just to not have that information. If you could use it. Yes.
Definitely.
So you came into nursing after having started a family and all of that. What would you tell someone in your position who wants to be a nurse? Who said, I have 3 kids, but I want to go to nursing school.
Well, if I did it, you can do it, is the first thing I would say. but it was not easy, right? Time management, that is of the utmost importance. Definitely, you have to manage your time. And I think because I did it at a time before we have all these social media influences, as you mentioned a little bit earlier, right? Oh,
Mhm.
there's all these different factors now involved in people's
Yeah,
life. Definitely. So I could see where someone a little bit younger in this day and age who's raised on social media or so used to it might have some challenges pulling back from that, but you have to eliminate the fluff, so to speak, right? Focus on your studies, focus on your family. And I definitely remember many times when my sons were young and studying, we'd all study together. Okay, kids, you do your homework and I'll do mine. And that's what we would do. And it actually was a good, I feel like I was a good role model for them in that regard to build good study skills and habits,
yeah,
instill those in them at an early age because I was
yeah,
studying while I was raising kids. So
yeah.
it's not easy, but if you want to do it, you can do it.
Let's
But
do it.
you just have to balance, like you said, what the octopus, right?
Yeah,
Be organized, eliminate things that you don't need to do, and outside influences that
yeah.
take your time, and that are not really necessary. They can maybe things that can be put off later. Do that. Prioritize.
Prioritize, 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 prioritize. It's
Yes.
like, yeah. What would you say if you had to say what you see as the most essential quality of a nurse in one word? What would that word be?
One word. Okay. And well, of course there
Yeah,
are many, right?
to
But one word, I would say first and foremost, compassion.
compassion.
I would
Hmm.
say compassion, because with compassion, if a person has compassion or empathy, right?
Hmm.
Very similar. Um, everything else should fall into place. Certainly you need to be smart, have a logical mind, curious mind, be honest, be
Yeah,
ethical, but compassion is a
yeah,
much needed quality. And I don't know about you, but through the years, either with a family member, is seeing them experience what they go through as a patient, or even as myself or yourself as a patient, occasionally you come across any healthcare pro, not just a nurse, right? That you might get a sense, hey, this person really is not liking this
yeah.
job,
Hmm.
right?
Hmm.
Or they're only in this for the money. It makes you think, right? But if you typically, one can tell if someone has compassion, they're really engaged in their patient and what they're doing.
That truly comes across.
Yes, it does. It
It
does.
comes across, and you just can't help it. It comes across.
Yes, definitely.
Yeah. So you mentioned earlier on you were talking about diabetics and self-care. What do you do to take care of you? I know, well, you said you're a dancer, bird watcher, health foodie, in that order.
Yeah, well, I do it all. I used to do karate. I studied karate for several years. So I studied dance as a younger person, as a child through my teen years, and got into karate for several years. Walking, hiking, running. I've always been very active. And I went back to dancing several years ago, ballet, jazz, tap. So I studied dancing. I love that. But I love to be outdoors also. So it's great to be in a dance studio and dance, but it's
Mhm.
also great to be outdoors. It's so refreshing as well. So I love hiking. And then I got into bird watching. I know a lot of people got into bird watching during COVID.
Yeah.
They were stuck home and had nothing to do, right, for a while. But I actually got into bird watching a few years before COVID hit. And
Hmm.
it's really fun because I can blend my love of being outdoors and
Outdoors.
getting
Hmm.
exercise with observing amazing birds. And
Yeah.
of course, if you like science, which as a nurse,
You
most nurses do love science. That's why we love what we do. It's great because it's a different type of science, the different genres of birds and all of that.
Yeah.
It's fun and
Yeah.
it gets you outdoors, and yeah.
Yeah.
Did
Yeah.
that answer
Yeah.
your question? I'm not sure. Did that answer your question, Dale?
Actually, yes. Actually, yes, it does. Yes, it does. Yes, it does. As you talked about birds and birds. I'm not exactly a bird watcher, but I do love my my bedroom faces a close of trees, and in the mornings the birds I don't need an alarm clock. It's the birds that wake me up. And it's such a great way to wake up, though.
It is definitely,
It is
definitely.
such a great way to wake up.
It's peaceful hearing the bird song, so to speak.
Yes, yes,
And
yes,
each
yes.
one has a slightly different variation to how they sing. It's
Yeah.
beautiful. Very
Mhm.
peaceful, very peaceful.
Yeah, yeah, yeah. It's good. It's good if you're able to pay attention to it. It is absolutely fantastic. A great way to wake up.
Yes.
So, Carol, thank you so much for this conversation. Is there any gem you'd like to leave us with?
Any gem. Oh my goodness. Well, if someone's thinking about nursing,
Mhm.
say be expected to work hard, study hard, value ethics and honesty, and your utmost concern is for your patients. So I think that's one thing I would tell new nurses coming along, and help other nurses. If you see they're struggling with something, help them, mentor them. If you're a more experienced nurse, because
Yeah,
we all heard that horrible saying, nurses eat their young, but there's other professions that do that too, or can do that. But it's so important to help and mentor others, that especially if you see they're struggling and they need some assistance. So I would say we want to be that person for others, just like I would want someone to help me and a fellow colleague if I'm struggling with something, right?
yeah, yeah,
I think
yeah,
it's good to be there for each other as professionals.
yeah,
Yeah.
yeah. And that compassion that you said was a necessary quality is one that we just need to extend to our colleagues as
Yes,
well as our
exactly.
patients.
Definitely extend to our colleagues. And by doing that, that also uplifts the entire profession as well.
Exactly.
Yeah.
Exactly. Exactly. And we'll stop saying nurses eat their young, and we'll start. There is a nurse. There's Teresa Sanderson who has a sort of thing that says
Yes.
nurses feed their young, and I
Yes, I
so
saw
love it.
that. Right.
I
I
so
love
love
that
it.
too. I recently connected with her on LinkedIn. Yes, I love that. It's fantastic. And that's what we should do. I see
Mhm.
some nurses say, "Oh, who was your mentor?" I wish I had had one specific mentor, so to speak. But hear different, yeah, I'm sure along the way, as you might have experienced, you get a few people here and there that give
Yeah.
you a little more mentoring. But I can't say I had an actual mentor, but one mentor. But it's good to be there for others. Definitely support each other in the workplace and outside of the workplace too.
Absolutely. Absolutely. Tara, I can't thank you enough for this conversation. It's been great meeting you and having a conversation with you. Truly,
Oh,
thank you.
thank you so much, Dale. Thank you for having me, and keep up the good work. I love your shows, and thank you for including me. Much appreciated.
My
Have a
pleasure.
thanks.